In this video, I'll cover 10 essential community pharmacist interview questions, providing expert guidelines, ideal responses, and real-life scenarios to help you excel in your interview. This is one of 15 videos designed to fully prepare you for a community pharmacist interview. So, let's begin. Question 41. How would you describe your work ethic? The following are guidelines of how to approach this question. Employers ask this question to assess a candidate's reliability, dedication, and approach to professional responsibilities in a community pharmacy setting. A strong response should demonstrate commitment to patient care, efficiency, teamwork, and compliance with pharmacy regulations. Emphasizing attention to detail, time management, and accountability will help convince the employer that the candidate is a right fit for the role. When answering this question, avoid generic or vague statements that do not provide insight into actual work behaviors or values. In Ireland, strong knowledge of the PSI Code of Conduct for Pharmacists and the Pharmacy Act 2007 is important as it ensures that pharmacists uphold professional integrity, prioritize patient safety, and comply with legal and ethical standards in their work ethic. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. I pride myself on having a strong work ethic centered on patient care, professionalism, and efficiency. I am highly organized and always ensure that prescriptions are dispensed safely and accurately while maintaining a high level of customer service. I believe in teamwork and communication, which helps create a supportive and efficient community pharmacy environment. Additionally, I consistently stay updated with PSI guidelines and best practices to ensure compliance with Irish pharmacy regulations. My commitment to professional integrity means I go above and beyond to provide safe and effective pharmaceutical care to every patient. Question 42. How do you stay motivated in a fast-paced pharmacy environment? The following are guidelines on how to approach this question. Employers ask this question to assess your resilience, work ethic, and ability to handle pressure in a fast-paced pharmacy environment. A strong response should highlight your passion for patient care, ability to stay organized, and strategies for maintaining focus under pressure. Emphasizing skills such as time management, teamwork, and adaptability will demonstrate that you can thrive in a demanding setting. When answering this question, avoid giving vague or generic responses that do not showcase specific strategies or personal motivation. In Ireland, a strong knowledge of the PSI's guidelines on the safe supply of medicines and their Pharmacy Act 2007 is important, as it ensures that patient safety and compliance are always prioritized, even in high-pressure situations. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. Staying motivated in a fast-paced pharmacy environment comes naturally to me because I am passionate about patient care and ensuring medication safety. I thrive on the dynamic nature of the job, where every day presents new challenges and learning opportunities. To stay focused, I prioritize effective time management, teamwork, and maintaining a positive mindset. I also make it a point to continuously update my knowledge of medications and pharmacy regulations, as staying informed helps me feel confident in my role. Ultimately, knowing that my work directly impacts patients' health and well-being keeps me motivated, even in high-pressure situations. Question 43. What would you do if you had a disagreement with a colleague? The following are guidelines of how to approach this question. Employers ask this question to assess your ability to handle workplace conflicts professionally, ensuring that disagreements do not affect patient safety, workflow, or team morale. The best approach is to demonstrate effective communication, emotional intelligence, problem-solving skills, and teamwork. Employers expect you to show that you can de-escalate conflicts, find solutions, and maintain professionalism while working collaboratively with colleagues. When answering this question, avoid blaming others, showing hostility, or indicating that you frequently experience conflicts at work. In an Irish pharmacy setting, strong knowledge of the PSI Code of Conduct and the Pharmacy Act 2007 is important as it ensures that pharmacists uphold professional integrity, teamwork, and ethical responsibility in resolving conflicts. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. If I had a disagreement with a colleague, I would first take a step back to understand their perspective and ensure that emotions do not escalate the situation. I would then engage in an open and respectful discussion, focusing on the facts and finding a solution that aligns with patient care and pharmacy procedures. If the issue remained unresolved, I would seek guidance from a senior pharmacist or manager while maintaining professionalism. My priority would always be to resolve the matter constructively to preserve a positive working environment. I believe that teamwork and communication are key in a pharmacy setting, where collaboration directly impacts patient safety and service quality. Example scenario. I remember when a colleague and I disagreed on the interpretation of a prescription that had unclear dosing instructions. While they believed the dose was correct, I was concerned about a potential overdose risk. To resolve the issue, I calmly explained my concerns and suggested that we consult the Summary of Product Characteristics, SMPC, and the BNF guidelines for clarification. We also decided to contact the prescribing doctor to confirm the correct dose. In the end, the doctor adjusted the prescription, and my colleague appreciated the collaborative approach. This experience reinforced the importance of professional discussions and teamwork in ensuring patient safety. Question 44. Describe a time when you had to adapt to a sudden change at work. The following are guidelines of how to approach this question. Employers ask this question to assess a candidate's ability to handle unexpected challenges in a community pharmacy setting, ensuring patient safety and efficient service delivery. The interviewee should demonstrate problem-solving skills, adaptability, teamwork, and decision-making under pressure. A strong answer should highlight how the interviewee remained calm, professional, and resourceful when faced with a sudden change. When answering this question, avoid giving a generic or vague response without a specific example, or focusing on negative aspects of the situation without showing a proactive resolution. In Ireland, strong knowledge of PSI's Code of Conduct and the Pharmacy Act 2007 is important as it ensures pharmacists uphold professional responsibility and high standards of care, even in unexpected circumstances. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. In a busy community pharmacy, unexpected changes can happen at any moment, and being adaptable is crucial. One instance that stands out was when our pharmacy's delivery system for urgent medications unexpectedly went down, leaving vulnerable patients at risk of not receiving their prescriptions on time. I immediately assessed the situation, coordinated with the team to identify high-priority cases, and contacted a local courier service to arrange alternative transport for essential deliveries. At the same time, I reassured patients about the delay and kept them informed of our efforts. This experience reinforced the importance of remaining composed, thinking critically, and ensuring patient care is not compromised even in difficult situations. Example scenario. I remember when we suddenly experienced a system failure while processing electronic prescriptions during a peak hour. Patients were waiting, and we had no immediate access to their records. I quickly collaborated with my colleagues to manually verify and dispense essential medications based on repeat prescriptions and patient history while contacting local GP surgeries to confirm urgent new prescriptions. Meanwhile, I reassured patients about the delay and prioritized those with time-sensitive medications. Once the system was restored, I cross-checked all dispensed medications to ensure accuracy. This situation demonstrated my ability to stay composed, communicate effectively, and adapt to unforeseen challenges while ensuring patient safety and satisfaction. Question 45. How do you handle long working hours and standing for extended periods? The following are guidelines of how to approach this question. Employers ask this question to assess the candidate's resilience, time management skills, and physical endurance, which are crucial for a community pharmacist. The interview expects a response that highlights adaptability, stress management, and strategies for maintaining productivity and focus during long shifts. The interviewee should demonstrate an ability to handle pressure while ensuring patient safety and efficient pharmacy operations. When answering this question, avoid giving vague or overly negative responses that suggest an inability to cope with the demands of the job. In Ireland, strong knowledge of the Safety, Health and Welfare at Work Act 2005 and PSI guidance on safe pharmacy practice is important as it ensures compliance with workplace safety standards and promotes well-being in a demanding pharmacy environment. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. I understand that long working hours and standing for extended periods are part of the role of a community pharmacist, and I have developed strategies to manage these challenges effectively. I ensure I stay well hydrated, take short mental breaks when possible, and maintain good posture to reduce physical strain. I also focus on time management and prioritization to stay efficient and reduce stress throughout the day. Additionally, I proactively communicate with my team to ensure smooth workflow and prevent unnecessary fatigue. My ability to stay energized and engaged during long shifts allows me to provide safe and high-quality patient care at all times. Question 46. What do you do if a customer complains about the pharmacy's service? The following are guidelines on how to approach this question. Employers ask this question to assess a pharmacist's ability to handle customer complaints, maintain professionalism, and ensure patient safety while upholding the reputation of the pharmacy. The interview expects a response that demonstrates problem-solving skills, active listening, empathy, and a patient-centered approach. The pharmacist should also show an understanding of conflict resolution and how to follow internal procedures for handling complaints. When answering this question, avoid being defensive, dismissing the customer's concerns, or failing to mention a follow-up process to resolve the issue. A strong knowledge of the PSI's Code of Conduct and the Consumer Protection Act 2007 is important as it ensures that complaints are handled in a lawful, ethical, and professional manner to maintain public trust in the pharmacy. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. If a customer complains about the pharmacy's service, I would first listen attentively and allow them to express their concerns fully without interruption. I would acknowledge their frustration and empathize with their situation, ensuring they feel heard and respected. I would then calmly explain any necessary clarifications regarding our procedures while seeking a suitable resolution, whether that involves rectifying an error, offering an alternative solution, or escalating the issue if needed. If the complaint requires further investigation, I would assure the customer that I will follow up promptly and keep them informed of the outcome. Throughout the interaction, I would maintain professionalism, follow pharmacy policies, and document the complaint appropriately to ensure compliance with PSI guidelines and continuous service improvement. Example scenario. I remember when a customer came in upset because they had been waiting longer than expected for their prescription. The situation was tense, and I could see they were frustrated. I calmly listened to their concerns and apologized for the delay, explaining that we had an unexpected backlog due to a high volume of prescriptions. I reassured them that their medication was being processed and offered to prioritize their order while ensuring accuracy. By maintaining professionalism and offering a sincere explanation, the customer felt acknowledged and left the pharmacy satisfied, appreciating the transparency and effort to resolve their issue. Question 47. Can you give an example of a time you provided excellent customer service? The following are guidelines on how to approach this question. Employers ask this question to assess a pharmacist's ability to deliver exceptional patient care, handle challenging situations effectively, and build strong patient relationships. The response should demonstrate effective communication skills, empathy, problem-solving abilities, and a patient-centered approach. To convince the employer, the interviewee should highlight a scenario where they went above and beyond to ensure a positive patient experience. When answering this question, avoid vague responses that lack specific details or focus solely on routine customer service interactions. In Ireland, strong knowledge of the PSI Code of Conduct and the Pharmacy Act 2007 is important as it ensures pharmacists adhere to ethical principles, professional obligations, and legal responsibilities in providing patient care. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. One of the most rewarding aspects of being a pharmacist is making a real difference in patients' lives through exceptional care. I always strive to ensure that every patient interaction is meaningful and tailored to their needs. One particular instance that stands out was when an elderly patient was struggling to understand their newly prescribed medication regimen. Recognizing their distress, I took the time to break down the instructions into simple terms, provided a written medication schedule, and even demonstrated how to use their inhaler correctly. Before they left, I reassured them that they could call or visit anytime for further clarification. A few days later, the patient returned to thank me, expressing how much my guidance had helped them feel more confident in managing their condition. Question 48. How do you handle a situation where you have multiple urgent tasks to complete at once? The following are guidelines of how to approach this question. Employers ask this question to assess a pharmacist's ability to multitask, prioritize, and remain calm under pressure. The ideal response should demonstrate time management skills, problem-solving abilities, and adaptability while ensuring patient safety and compliance with regulations. A strong answer should highlight the ability to assess urgency, delegate tasks where appropriate, and utilize an efficient workflow. When answering this question, avoid giving vague or overly general responses that do not demonstrate a clear strategy or real-life application. In Ireland, strong knowledge of the PSI's guidelines on the safe supply of medicines and the Pharmacy Act 2007 is important as it ensures pharmacists uphold patient safety while managing high workloads effectively. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. In a busy pharmacy setting, I prioritize tasks based on urgency and patient safety. If multiple urgent tasks arise, I assess which requires immediate attention, such as dispensing urgent prescriptions, handling patient queries, or dealing with stock deliveries. I use effective time management, delegate tasks where possible to the pharmacy team, and communicate clearly to ensure workflow efficiency. Staying calm and methodical helps prevent errors while maintaining excellent customer service. My focus is always on ensuring patient care is not compromised, and I adjust my approach dynamically to manage workload efficiently. Example scenario. I remember when we had a sudden influx of prescriptions during a busy flu vaccination season while also managing stock deliveries and patient consultations. I quickly assessed priorities, ensuring that urgent prescriptions were dispensed first, while delegating stock management to a technician and asking a colleague to assist with minor queries. I kept patients informed about wait times to manage expectations. By maintaining a structured approach and clear communication, we ensured timely dispensing, minimized delays, and provided safe and efficient service to all patients. This experience reinforced my ability to handle pressure while maintaining patient safety and service quality. Question 49. Why should we hire you over other candidates? The following are guidelines on how to approach this question. Employers ask this question to assess what sets you apart from other candidates and to gauge your understanding of the role and your ability to meet the pharmacist's needs. To answer effectively, highlight your clinical expertise, patient-centered approach, and problem-solving skills while demonstrating your ability to contribute positively to the pharmacy team. Emphasize specific skills such as medication safety, customer service, and compliance with regulatory requirements that align with the responsibilities of a community pharmacist. When answering this question, avoid generic or vague responses that do not showcase your unique strengths or experiences. In Ireland, a strong knowledge of the Pharmacy Act 2007 and the PSI Code of Conduct for Pharmacists is important as it ensures you understand the legal and ethical responsibilities of the profession, including safe dispensing, patient confidentiality, and professional integrity. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. I believe I am the right candidate for this role because I bring a combination of clinical expertise, patient-focused care, and a strong commitment to regulatory compliance. With my experience in medication management and patient counseling, I ensure that patients receive the best possible care while adhering to legal and ethical standards. Additionally, I am skilled in identifying potential drug interactions, optimizing medication therapy, and providing health advice tailored to patients' needs. I also excel in building strong relationships with patients and the pharmacy team, fostering a supportive and efficient work environment. Most importantly, I have a deep understanding of the Pharmacy Act 2007 and PSI guidelines, ensuring that all services provided are in full compliance with professional standards. Question 50. What do you think is the biggest challenge facing community pharmacies in Ireland today? The following are guidelines of how to approach this question. Employers ask this question to assess a candidate's awareness of current industry challenges and their ability to adapt, problem solve, and contribute effectively in a community pharmacy setting. The response should demonstrate a strong understanding of the evolving role of pharmacists, the impact of healthcare policies, and the challenges posed by economic and operational factors. The interviewee should exhibit critical thinking skills, an ability to navigate change, and a commitment to patient-centered care. When answering this question, avoid providing a vague or overly general response without demonstrating depth of understanding or offering a potential solution. In particular, strong knowledge of PSI's guidance on safe supply of medicines and the Medicines Act 2007 is important as it ensures compliance with regulations affecting pharmacy practice, including supply chain concerns and patient safety issues. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. One of the biggest challenges facing community pharmacies in Ireland today is the increasing pressure from rising workload demands and staffing shortages, which can affect patient safety and service quality. With growing responsibilities, including medicine reviews, vaccinations, and extended patient consultations, pharmacists must manage their time effectively while maintaining clinical accuracy. Additionally, the financial strain on pharmacies due to reimbursement reductions and high operational costs adds further complexity. The evolving role of pharmacists in healthcare is positive, but ensuring adequate resources and support is essential to sustain high standards of care. Staying informed on PSI regulations and HSE reimbursement policies allows us to navigate these challenges while prioritizing patient well-being. Thanks for watching. If you found this video helpful, don't forget to give it a thumbs up and share it with others. Subscribe to this channel and hit the notification bell so you never miss an update in the series that we are doing. For more learning resources, check the description below. See you in the next video.